Welcome to the workshop, Eating Well After Transplant and CAR T Cell Therapy, Why It Matters. My name is Marcia, and I will be your moderator for this workshop. It is a pleasure to introduce today's speaker, Ms. Layla Silverman. Layla Silverman is a registered dietitian and board-certified specialist in oncology nutrition. She is the clinical nutrition coordinator and bone marrow transplant interdisciplinary team member at Memorial Cancer Institute in Pembroke Pines, Florida. In addition to her work at Memorial Cancer Institute, Ms. Silverman is involved in community outreach and has facilitated many cancer prevention programs. Her goal is to translate evidence-based nutrition science into practical advice for patients. Please join me in welcoming Layla Silverman.
Thank you, Marcia. It's a pleasure to be here. So let's go right in. So I'm talking today about why nutrition matters after transplant and CAR T cell therapy. So thank you for joining me. Our objectives today are for you guys to learn about your nutritional needs after CAR T cell therapy or transplant, how to manage symptoms that impact adequate nutrition afterwards as well. And we're also going to learn about the American Institute for Cancer Research recommendations for eating healthier, ways to plan healthier meals. And then we'll also talk a little bit about popular diets and if they're right for you. So we hope you learn a lot. So let's start with your nutritional needs after transplant or CAR T cell therapy. What we normally recommend is a diet that's high in protein, high in calories. Those two things are very important after these therapies. Also, maintaining adequate fluid intake is very important. We also have to make sure that patients remain mindful of food safety to minimize any infection risk after the therapies. And also, we're going to talk about how to manage symptoms that impact adequate nutrition. So we'll dive into each one of these individually. So, how can you get more protein into your diet, especially when you're struggling? One of the main things that we try to get patients to do is to add high protein snacks between meals. The more often you eat, the more chances you get of getting enough protein in your diet. Every meal counts, every bite counts. So, every meal and every snack should include a source of protein. These can be animal proteins or plant proteins. So, some examples can be as simple as having some yogurt with fruit. And it doesn't have to be regular milk based yogurt, it can be a non dairy yogurt. There's a lot of options out there nowadays. Another quick and easy snack can be like peanut butter or almond butter with crackers. It can also be any other nut butters. There's so many out there. There's cashew nut butters as well. So any nut butter combined with crackers can be an easy snack for you to get some extra protein into your diet. It can be cheese and fruit. It could be cottage cheese and fruit. And also sometimes a protein shake can be very handy. It can be homemade or store bought. If you get a store bought shake, there's a wide variety of those at the stores. And it's just an easy way to get some extra protein into your diet. There's a lot of high protein shakes. And it can be plant based or milk based protein. How can you get more calories? So, protein is not the only thing that's important. Calories are very important as well, especially if you're losing weight. So, you need to get some extra calories in every meal and every snack. So, again, eating every 2 to 3 hours, eating more often, even if it's just a little bit. A few bites is better than eating nothing or skipping that meal. So make sure that every 2 to 3 hours you're getting a little something to eat. Things that are high in calories can be some of the healthy fats. So maybe a snack can be some crackers and avocado, like a guacamole, or it can be crackers and peanut butter, like I mentioned earlier. Peanut butter, almond butter, avocado, olive oil, those give us healthy fats. And then again, you can do a high calorie or a high protein shake. And like I mentioned before, it can be dairy based or non dairy based. Some of the non dairy based shakes are easier to tolerate, especially if you're having symptoms like diarrhea. And then, besides getting enough protein and calories, we need to make sure that you're getting enough fluids in your diet as well. A lot of the symptoms after transplant or CAR T cell therapy can make you dehydrated very quickly. If you're nauseous and vomiting, or if you're having diarrhea, you can get dehydrated very quickly. So, making sure you're getting enough fluids in your diet is important. Um, One of the main things that I try to get patients to do is to always keep a water bottle with them. Every sip counts. Sometimes patients are very forgetful. They have so many things going on. So you'd have to set a reminder somewhere. And nowadays, everyone has a smartphone. So setting a reminder on your smartphone or on your smartphone can be, something easy to do to help you get enough fluids. And it's not just water. There's foods that are hydrating as well, like fruits, jello, or broth based soup, popsicles. Those things count as fluid as well. Um, Sometimes, if you're losing fluids from symptoms like the vomiting or the diarrhea, you need to replace the electrolytes that you're using. So, you need to make sure you're having some fluids that have electrolytes in them, like Gatorade, Pedialyte, and there are other various brands nowadays. So, just find something that works for you. There's a lot of powders that you can add to a water bottle that add electrolytes to your water. So that's fine too. Another natural electrolyte drink could be coconut water, which is very high in potassium. If you feel like you're not drinking enough water because it doesn't taste good to you, then add some flavor to it. You can add a splash of juice. You can cut up some fruit and infuse your water with a little bit of flavor that way. But fluids are always going to be important. So make sure you find a way where you can get enough fluids in your diet. For the most part, most people need about 8 cups of fluid a day. It really depends on your weight. So, what I always tell patients to do is to look at their weight in pounds, divide that by two, and that's more or less how many ounces you need in a day. So, if you weigh 120 pounds, divided by two, that's 60. So, you need around 60 ounces a day of fluid. Food safety precautions. So you have to remain mindful of what you're eating so that you don't get sick from something you ate. So food safety is very important after CAR T and transplant. One of the most important things you'll do to prevent any foodborne illness is going to be to wash your hands and disinfect all the surfaces from where you're preparing your food. Make sure you're also checking expiration dates on food. You'd be surprised how many foods you find at the grocery store that are about to expire. So make sure you're checking those expiration dates. Also, make sure that you're not eating any undercooked meats, and especially no raw meats. So no sushi, no undercooked steaks, or anything like that. Also, make sure that you're not leaving food out for too long. Food shouldn't be out for more than 2 hours after cooking. If you're not going to eat it within those 2 hours, just put it in the refrigerator. Um, for fruits and vegetables, make sure you're washing those thoroughly. Even if it's something that comes in a bag, like bagged lettuce or spinach that says it's been washed already or triple washed, you still need to rinse it at home. So make sure you wash all your fruits and vegetables thoroughly and follow the guidelines that were provided to you by your healthcare provider. Every facility is a little bit different. Um, in my institution, we do allow the fresh fruits and vegetables as long as they're washed thoroughly. But in other institutions, I've had patients come from other places where they were told they couldn't have any. So just check with your own healthcare provider for that. So, some of the symptoms that we're going to discuss a little bit more in detail that can impact nutrition after transplant and CAR T cell therapy are nausea, diarrhea, taste changes, mouth sores, constipation, and the loss of appetite and weight. So, let's start with nausea. One of the most important things I tell my patients to do is to make sure that they're eating more frequently. The longer you go without eating, the more nauseous you can get. So if you're feeling a little queasy and you don't want to eat, have at least a couple of crackers or a few salted nuts or a few pretzels. Have something in your stomach because that's going to help prevent the nausea from getting worse. Um, Also, make sure you're drinking enough fluids. Sometimes patients are not drinking enough fluids, and so you have to take sips throughout the entire day. If you're already nauseous, um, you need to still get enough fluids. So make sure you're flavoring your water if it doesn't taste good to you, like I mentioned earlier. You can also try some natural remedies for nausea in addition to your medications. For example, ginger is really good for nausea, mint as well. You can do like a ginger tea or a mint tea. You can also do like ginger candy or mints to help with the nausea. Avoid foods that have a strong odor because that can trigger your nausea. And just keep your diet bland, easy to digest. Keep it simple. Um, but still make sure you're eating at least something every couple of hours. If you're having diarrhea, diarrhea is a little bit more tricky. What we normally recommend is a diet that's low in fiber. Nothing too greasy, nothing too spicy or acidic. Dairy can make diarrhea worse if you already have the diarrhea. It's not going to cause it, but it can make it worse. So you want to try and limit the dairy as much as you can, or maybe choose the lactose free dairy options. Um, a low fiber diet basically means that you're not going to have things like a salad or beans or nuts and seeds if you're having diarrhea. You're going to keep it very simple, very low fiber. Usually, the things that we normally say aren't as healthy, like white rice, white bread, are the things that are going to help you if you're having the diarrhea. So, we try to educate patients on the BRATT diet, which basically stands for banana, rice, applesauce, toast, and tea. And basically, you have this for breakfast, lunch, and dinner. Now, you can't stay on this diet for too long because it's not a complete diet, but it's something you would do for maybe a day or two. And then you slowly add protein foods to it, but you can add things like broth on a BRAT diet. So it's kind of like a modified BRAT diet. You can add a hard boiled egg. You can add some baked chicken, to get a little extra nutrients while you're on the BRAT diet. But it really does help to just keep it simple when you have the diarrhea. And all of this is in addition to taking your medicine. Okay. Now, if you're experiencing taste changes, which are actually very common after transplanting CAR T cell therapy, um, these are some suggestions you can try. So, if you have a metallic taste in your mouth, maybe you need to add a little sweetener to your food or add a little healthy fat. Maybe drizzle a little bit of olive oil on your food. It can help with the metallic taste. Or you need to marinate your meats. A lot of times when there's taste changes, what patients tend to stop eating first is the protein. So, like the chicken, the fish, the meats, because it just doesn't taste good to them. So, if you try to marinate those proteins, it will help it taste better to you. Some patients complain of a taste that's too sweet. Everything tastes very sweet. So, you can add a few drops of lemon to your food if that's the case. Um, if it's too salty, salty is very difficult as well, but you can also add an acid, so maybe a little bit of lemon or lime juice to your food. If it's too bitter, you do the opposite. You make it a little sweeter. Cardboard. So this is when food has no taste. So you have to add a little salt, or you can add a few drops of lemon juice as well. Try that. Or you can try different seasonings, maybe something you are not used to, a different spice. Okay. If it's too sour, also add a little bit of sweetener and see if that helps. So different things you can try. But another thing that I tell patients to make sure they're doing is that they're drinking enough fluids because a lot of times these taste changes get better if they're better hydrated. So, hydration is always important. If you develop mouth sores, this can be very difficult for patients and it really limits their intake after transplant or CAR T cell therapy. Some of the things we try to do with patients is have them start doing an oral rinse with salt, baking soda, and water. It's very much diluted, and you kind of just use that throughout the day. You can also try some oil pulling. Oil pulling? It's an ancient practice that is basically swishing oil in your mouth for like 1 or 2 minutes. You can use coconut oil, and it has antibacterial properties, and it's also soothing for a lot of patients. So it helps with those sores in the mouth. Obviously, if you have sores in your mouth, you're going to try to avoid things that are too spicy or acidic because that's only going to make it worse. It's going to be irritating. And you're also going to try to choose foods that are soft and moist, things that have a sauce or gravy on them, so they're nice and easy to swallow. And another thing that's very important is to make sure that the toothbrush that you're using is soft so you don't further irritate your gums. Now, if you're constipated, which can be related to either not drinking enough fluid or maybe you're just not eating enough, so you're not having a bowel movement every day. Um, Also, some pain and nausea medications can cause constipation. So it's something that happens as well. And if you are constipated, you're going to do a high fiber diet. So we want you to get more fiber because that helps regulate you better. Um, but in addition to getting more fiber, we also try to get patients to drink more fluids because the more fiber you eat, the more fluids you need. Um, so that is very important. They go hand in hand. So increase your fluid intake. Sometimes warm liquids work better than just cold. So we try to get patients to do that, maybe some teas at night. You can also try prune juice and prunes, those are very effective. And there's a tea called Smooth Move that tends to be very effective for a lot of patients that are suffering from constipation. And all of this, of course, is in addition to any medications that you're prescribed. If you have a loss of appetite and weight loss, and again, small frequent meals, I can't emphasize that enough. So every 2 to 3 hours, you're going to be eating something because you're eating less. If you don't have an appetite, you're likely eating much less than you were eating before. So you need to eat a little more often so that at the end of the day, you get enough calories and enough protein. Also, try to make the most out of every small bite. Make sure you're eating foods that are higher in calories, higher in protein. Sometimes drinking something is easier than eating, so you can try a protein shake, a nutritional supplement that way. Try different foods, and what I mean by that is like foods that are seasoned differently or something that you're not used to eating. Try something new. Also, make sure you're making mealtime special. If you don't have an appetite, at least you want to have a good time. So, set up your table nicely. Make sure you're eating with someone. When you eat alone, you tend to not eat as much. So, eat with family, with friends. Um, and try to think of something that sounds appetizing to you. When you don't have an appetite, I know you probably can't think of anything, but there's always something like a guilty pleasure that you might want to take advantage of. And honestly, if you're losing weight, we want you to eat. Even if it's something that's not very healthy, we still want you to eat it because we need you to get more calories. We want you to stop the weight loss. So keep that in mind. And besides dealing with symptoms, once the symptoms get better, once you're feeling a little bit better, then we try to get patients to focus a little bit on eating healthier. Okay. So if your appetite is much better, your weight is more stable, you don't have any nausea or vomiting or diarrhea, then this is the time when you can start focusing a little bit more on eating healthier. So what we do is we follow the recommendations from the American Institute on Cancer Research. They have a really good website. I do invite you guys to visit that. They have really good information. Um, and some of their recommendations are Number one, to cut back on red meat, also limit processed meats. And we're going to talk about each one of these more in detail, including more whole grains and beans, increasing your vegetable and fruit intake, limiting alcohol, if any, and getting to a healthier weight and also staying active. So these are the things that we try to get patients to do once they're feeling better. So let's start with red meat. So, red meat includes beef, veal, pork, venison, bison. Some people think that pork is the other white meat, but it really isn't. It's still considered a red meat. So, the recommendation is to have less than 18 ounces per week. And when you do have it, to make sure that it's a lean cut. Okay. Another important thing when it comes to meats is that you want to cook it at a low to medium temperature because we don't want you to be eating meats that are charred. These are carcinogenic. So make sure that you can brown the meat, but you don't let it burn. Okay? And if it did burn, take that piece out and don't eat it. Okay? Usually, the meats that will burn faster are the fatty meats. So that's why it's also important to choose lean cuts. And then processed meats. So nitrates are also carcinogenic, and nitrates are found in processed meats. Um, Actually, the World Health Organization classifies them as carcinogenic, and they're in the same group as smoking. So keep that in mind. There's no recommended amount, but what we tell patients to do is to eat as little as possible of these processed meats. And that includes deli meats, bacon, sausage, hot dogs, things like that. Um, so nowadays, you can find some brands that are nitrate free, and that's okay. If it's nitrate free, you can have it, but it will still have quite a bit of sodium. So it's not the healthiest option. If you're looking at making a sandwich, maybe choose something else. You can do maybe like a tuna salad or a chicken salad, but just try to limit the processed meats as much as you can. Choosing whole grains and beans. This is a very important recommendation. Um, why? Because whole grains and beans give us a lot of fiber, they give us B vitamins, iron, magnesium, selenium, so a lot of minerals. Um, and some of the sources of whole grains are going to be like your ancient grains, but also barley, oats, quinoa, buckwheat, black rice and beans. It's not a typo. There is black rice. There's black beans too, but all these things give us a lot of fiber. Some of them give us quite a bit of protein too, like the beans and the quinoa. Some of the benefits is that it has been shown to reduce certain cancers like colon cancer. It also helps us regulate digestion. Fiber is actually also called a prebiotic. I'm sure a lot of you have heard of probiotics, but prebiotics are actually the food for the probiotics. So they help your gut. They help keep your gut healthy because they help keep the probiotics multiplying. So if you eat enough fiber, the probiotics in your colon will keep multiplying, which is good for everything. And fiber also helps regulate blood glucose if you're having trouble controlling that. So whole grains and beans are very important. So they should be a part of your healthy survivorship diet. Um, Another recommendation is to increase fruit and vegetable intake. And this sounds very simple or very basic, but it's really one of the hardest things to do on a consistent basis. The recommendation is to do between 3.5 to 5 cups of fruits and vegetables per day. Um, the most important thing, though, is to make sure you're having different colors. So the more colors, the better. They say to eat the rainbow, you really should be eating the rainbow. So try to choose as many different colors as you can. Try to think of what vegetables you can add to every dish that you're making, whether it's, in the sauce that goes with it or in the actual dish. Make sure you're always adding some veggies in there. So, for example, to get your goal of fruits and vegetables, you can do maybe a cup of fruit in the morning with your breakfast, and then have 2 cups of vegetables with lunch and two with dinner. This means that half your plate for lunch and dinner should be vegetables. And they don't always have to be fresh, although fresh are going to be the best tasting vegetables. They can be frozen. They can even be canned. The only problem with canned veggies would be that they're a little higher in sodium. But nowadays, you can find low sodium varieties. So, whatever works for you, as long as you're increasing the amount of fruits and vegetables that you're eating a day, that is always going to help your overall health. Another recommendation for survivors is to limit alcohol. And when you have it in moderation, if at all. So any amount of alcohol can increase your risk for cancer recurrence. Um, Also, if you're on active treatment or if you're still dealing with symptoms, you need to ask your healthcare provider if that's a good time for you to have any alcohol. Many times, our recommendation is to avoid it for a very long time after transplant or CAR T cell therapy because it really just depends on how you're doing at that moment. The serving size for moderate intake, one serving is about an ounce and a half of liquor, 5 ounces of wine, or 12 ounces of beer. And so, drinking in moderation means that if you're a woman, you would drink one drink in a day, and if you're a man, it would be 2 drinks in a day. It doesn't mean you would do this every day, but just the least amount possible with the least amount or the less frequent as you can. And then one of the last recommendations is getting to a healthier weight. Um, so we are always looking at the BMI. We know that excess body fat can increase our risk for cancer, but also for other things like cardiovascular problems. Um, and getting to a healthier weight means you're going to try and do a balanced diet. You're going to try to exercise, and it's really both together. You can't do one without the other or it's going to take forever to get to a healthier weight. So make sure you're doing both. You're balancing your diet and you're also trying to stay as active as you can. The BMI is a good guide, but it's not perfect and it's not the only thing you should be looking at when you're thinking about getting to a healthier weight because BMI does not take into consideration body composition. So if you're someone that has a lot of muscle weighs more. So you might be in the overweight category here, but it doesn't mean you're overweight because you just have more muscle. So it's one of the things you can look at, but it shouldn't be the only thing you're looking at. And then exercise. So to get to a healthier weight, remember you need to stay active. Every little bit counts. So just start slow and increase as tolerated as you can. Always talk to your doctor because maybe this is not a good time for you to be active, but maybe, in a couple of weeks it will be. So just consult with your healthcare provider. But exercise is important not only for your physical health, but also for your mental health. So it helps you feel better, it enhances your quality of life. And even though a lot of patients complain of being tired, feeling fatigued, it really does help with that. It's hard at the beginning because you have to push yourself to get out and go for a walk. But once you do it, it kind of gives you energy too, and it makes you feel better. So make sure you're including that. And a lot of cancer centers will have a exercise program for cancer survivors. So make sure you're asking your healthcare provider if that's something that's available to you. And then besides talking about the recommendations, I also wanted to talk a little bit about planning healthier meals. So it's important to make sure that we're planning ahead to be successful. So when you're planning meals, make sure that you're writing it down. In this planning process, include your family, make it enjoyable. Take a look at what you already have at home. Go online, look at flyers from your local grocery stores. Oftentimes they give you ideas for healthy meals as well. So make a list when you go shopping and stick to your list. Also, make sure that when you're planning your meals, you are also planning to use those leftovers eventually. So let's take a look at planning for breakfast. Make sure that you're always thinking about what protein you're going to add to your diet. Okay. So proteins for breakfast can include eggs, dairy or non dairy alternatives, nuts and seeds or nut butters. Um, it's important to include a carbohydrate, so make sure you have some whole grains available to you or add them to your list, like whole wheat bread. Make sure you have some fruit at home so that you can have some fruit in the morning with your breakfast. And say you only have oranges at home. Maybe add a little variety because maybe you don't want to eat oranges every day for the next week. And also, another important thing when you're planning meals is that to make sure that you are you are including a healthy fat, especially if you're losing weight and trying to get extra calories. So here are some examples of breakfast. It can be something as simple as some oatmeal cooked with milk. You add a little bit of peanut butter or nuts and a little bit of fruit. So you can keep it as simple as you can, or you can get a little fancy and add other things to it as well. Let's take a look at lunch. Again, we're going to look at protein first. What's going to be our protein for our lunches? Do you have chicken at home? Yeah, the meats are going to be perishable, so you only want to buy what you're going to use. But you can always keep the non-perishable proteins at home as well. So like beans, lentils, high protein grains. Make sure you keep that at home. Make sure you have some whole grains, some brown rice, some whole wheat pasta, and some vegetables, and also a healthy fat. So, we talked earlier about avocados. That's a good thing to keep at home too, especially if you need those extra calories. And then here are some examples of lunches. You can keep it simple. It can be a salad, it can be a sandwich. If you're doing a salad, though, I always try to get patients to make sure that they're adding at least 5 different vegetables to their salad. It sounds like a lot, but um, it's really not that hard, especially if you're buying a bagged lettuce mix, which already has like 2 or 3 vegetables in it. So keep that in mind. Now, let's take a look at dinner. When you're planning dinner, again, you want to make sure you're planning for the protein. Um, and then for dinner, I do want to mention some recommendations. We said to cut back on red meat, so make sure that you're having at least 1 to 2 meatless meals per week. That will help you cut back on the red meat. You don't want to have red meat more than twice a week in total, not just for dinner, but any meal twice a week or less. Try to have more fish. Try to aim for at least twice a week to have fish. Again, have some whole grains at home, some vegetables, and some of those healthy fats available to you. So some examples, again, you can keep it as simple or as fancy as you want, but it can just be fish, brown rice, and some steamed veggies. And if you want to keep it plant-based, maybe you want to have some beans with some quinoa, a little side salad, and some avocado if you need those extra calories. So these are just some examples. And besides going through some examples of different meals, I also wanted to talk a little bit about popular diets, because there's a lot of fad diets out there, and these are some of the questions we get often with patients. So we're going to try to review very quickly the alkaline diet, the ketogenic diet, and the Mediterranean diet. So the alkaline diet, in theory, what it means is that an acid environment causes or promotes cancer. So the alkaline diet tries to make your diet more alkaline by eating more fruits, vegetables, limiting red meat, sugar, white starches. Um, and, the thought is that this will create a more alkaline environment. But the fact is that our body already does that. Our pH is controlled already. Our bodies do that on their own. So there's really no clinical data that show any benefits in this. However, alkaline diet does include a lot of high fiber and plant foods, which are not bad for us. They can be beneficial. So you can still follow some aspects of this diet. Just make sure you're getting enough protein and calories. So this diet tends to be a little low in calories, low in protein, vitamin D, and calcium. So again, in you can follow some aspects of it, just not to the T. Ketogenic diet, very popular. So ketogenic diet is basically high in fat, high in protein, and low in carbohydrates. So the thought is that you're restricting glucose and you're starving cancer cells and producing ketones, which can be toxic to cancer cells. But really, the fact is that there is a place for the ketogenic diet, but it's mainly in people that have epilepsy, glioblastomas, but it's really not the standard of care. Plus, it's very hard to follow. So, at first, it may cause very significant weight loss, which is not ideal for transplant patients. This diet may not be a good idea for someone who's already losing weight. Another diet, the Mediterranean diet, which is very popular, and actually this one is is a good one. So it's rich in olive oils, fish, nuts, leafy greens, vegetables, and it is based on the traditional diets from people that live in the Mediterranean. It's high in anti-inflammatory foods, which is good for us. So the fact is that the Mediterranean diet is actually a good diet and it has been proven to be beneficial for heart disease, diabetes, dementia, and some types of cancer as well. So the only thing is that if you're new to this diet, just make small changes at a time so you don't cause drastic weight changes. But overall, it's a good diet for cancer survivors. All right. So we're nearing the end here. So the take home message today for you, all of you is that immediately after transplant or CAR T cell therapy, your needs are basically to maintain your energy and manage symptoms. That should be your focus. Once your symptoms are under control, then you can focus on eating healthier. You can try and plan your meals ahead of time to help you be successful in eating a more balanced diet. And remember, not every meal will be perfect. Be gentle to yourself and celebrate the small wins. So every little change that you make sure you celebrate that so that you can keep going. Thank you for this opportunity, and that's all I have for now. If we have questions.
Thank you, Ms. Silverman, for all the important information on diet and nutrition. Let's get to the question and answer session. If you have a question for Ms. Silverman, please use the chat box on the left side of the screen to submit your question. We will answer as many questions as possible. Our first question is, how do you suggest washing fruits and vegetables? Just water, dish soap, or anything else?
So, to wash fruits and vegetables, you only need water and friction. But if you need to use something extra, you can use a little bit of vinegar, especially if it's something that's hard to wash. So, like berries, raspberries, blueberries, things like that, you can put them in a little bit of water with vinegar. But if it's something like something that grows underground, like carrots or potatoes, you can use a little bit of brush and water. You don't need anything extra.
The next person first would like to thank you for your discussion and would like to know your thoughts about using nutritional yeast or tempeh. Uh, they ask, is there a concern in regard to food safety with having these foods?
So as long as they're pasteurized, they should be fine. They do add some protein to your diet, but just check the label. I'm not sure if the nutritional yeast would be pasteurized. I'm pretty sure there are some varieties that are. So just look for that, and then the tempeh you can find it pasteurized.
Is it okay for multiple myeloma patients to use honey?
Yes, but it needs again to be pasteurized. You can find pasteurized honey nowadays. Um, so yes, but it needs to be pasteurized.
Do you recommend bulgur in place of brown rice?
Yes, that would be a good option. That would give you probably more protein than the brown rice, and you still get fiber from either of the two. So yes, that would be a good option.
When it comes to supplements, I'm always told to buy a good brand. How on earth do I know what is a good brand?
So there is a certification. I can't think of the name right now, but some supplement companies do third party testing, which means they hire a company to test their supplement and make sure that what they have on the label is what's in the bottle. So as long as they're third party certified, then it's a better quality supplement. You can search up online. There's a certification for that for third party testing.
Coffee is the only way I am able to take my meds without becoming sleepy. What else could I do?
You can also try green tea. You not only get the caffeine, but you also get some antioxidants. Um, if you're drinking coffee when you're taking your medications, just make sure that it's not too late in the day so it doesn't affect your sleep at night. Um, but yeah, or you can do the half calf, has the half the caffeine as regular coffee.
What can you eat to prepare for a PET scan, as I am told to not eat any carbohydrates after lunch the day before the exam?
Um, if they've told you not to have any carbohydrates, you can still have your vegetables. You can have, your protein, chicken, fish. You can do grilled chicken, grilled fish with maybe some steamed broccoli or, asparagus. It's only probably for a half a day, so it's going to be like one or two meals that are going to be low in carbohydrates. So that's fine.
My naturopath suggests muscle building diets. Red meats build red blood cells. Do organic broths build red blood cells?
Um, do organic broths build red blood cells? Well, the broth is doesn't really have iron. It's just, you know, it may have some protein, but it doesn't really have iron. So I don't think it's going to build red blood cells, the broth alone. Um, yeah, I don't know exactly what they mean by the question. Sorry. Hello?
In reference to diet, are chicken and seafood better options than red meat?
Yes, they're better options than red meat. Like I said in the presentation, it doesn't mean you have to stay away completely from red meat. But yes, definitely chicken and fish will be better. Fish would probably be the best because you're getting your omega 3s, which are the anti inflammatory fats.
At the time of my transplant, I was told that I should never eat raw eggs or fish again. It's been 20 years. Are Caesar salads and homemade mayonnaise still off limits?
You can check with your healthcare provider your counts. It's really based on your counts, whether your immune system has completely recovered or not. If it's been that long, I would check with your doctor to see if you still need to be on the low immunity diet. A lot of times, I can tell you in my facility, it's on a case by case basis, and a lot of times our doctors will make an exception, if it's something you really want to have. But Caesar dressing, if it's in the bottle at the grocery store, that's going to be pasteurized. So it's going to be okay.
Are consuming mushrooms appropriate due to them being a fungus?
Mushrooms are fine to eat. We allow them in our facility as long as they're cooked. But you can ask your healthcare provider to see what's allowed and not allowed at the center you're going to.
Is ground turkey a good option?
Brown turkey is an excellent option if you're trying to cut back on red meat. You can use it in every way where you would use ground beef. So you can do turkey burgers, turkey chili. So, yes, it's a good option.
Someone would like to know how long you can drink kefir. Can you do that all year long?
You can drink kefir, every day. It's a healthy food. It gives you probiotics. If it's right after transplant, just make sure it's pasteurized. Most of the ones that you buy at the grocery store are pasteurized, so there's no issue there.
How many grams of protein are needed daily?
So the grams of protein that you need every day depend on your weight. Usually after transplant, when you need the most, what we recommend for our patients, it's about a gram and a half for every kilo of your weight.
What is your opinion of prepared meals that come in a box to your home?
If you're talking about right after transplant, where when we're worried the most about food safety, um, you'd have to make sure that those meals are still frozen when you receive them, and that you keep them frozen after that. If they're not frozen, if they're fresh meals, we usually don't recommend our patients to eat leftovers that are more than 2 days old. So you wouldn't want to keep those in the fridge for more than 2 days. Um, so it really depends on what kind of meals you're getting delivered.
Does coffee contribute to cancer, and how much is safe to drink on a daily basis?
No, coffee does not contribute to cancer. I always tell patients, you can drink 1 cup a day as long as you're drinking enough water.
For protein powders, considering whey based versus plant based, would you recommend one over the other after transplant?
It depends on your situation. So if you don't have diarrhea is the main reason why I would choose one over the other. So if you're having diarrhea, I wouldn't get the whey protein, I would get the plant-based. Patients tend to tolerate it a little bit better because it's non-dairy. But if you're not having that issue, you can choose either one.
I recall reading that we should limit fish intake due to mercury levels. Is this still true? Is fish twice a week too much for dangerous mercury levels?
So it depends on the type of fish you're eating. There are some fish that are very high in mercury, but most people don't eat those. So, like the Chilean sea bass, the orange roughy, the larger fish, because they eat the smaller fish, so they have more mercury in them. Um, but just look it up and see if you're eating a fish that's high in mercury. If you're not, like most people are eating like salmon, mahi mahi, tilapia. Those would be very low in mercury, and you can have them every day if you wanted.
Okay, I know you talked about this in your presentation, but someone would like you to clarify a little bit more about pork being told that pork is a red meat after years of commercials stating that it's the other white meat, and just they would like a little more clarification on that.
So it was just a marketing thing, that calling it the other white meat, but it's really just considered red meat, and it's mainly because of its fat content. So again, it doesn't mean you can't have any. You just have to choose the very lean cuts and have it twice a week or less.
And I know you talked about raw eggs as well, but someone would like to know if it's okay in a salad dressing or a pasta dish.
Raw eggs right after transplant? No. So not if they're raw, unpasteurized. No.
Are you familiar with mushroom coffee and the benefits of it?
Yes, I have heard about it. Um, it's become very, very popular. Mushrooms are good for us. They have a lot of nutrients in them. But I am not sure how good those um, drinks that are being sold are, and I don't know exactly what mushrooms they're using either. So you would have to look at that particular product and see what's in it, specifically, and see if it's something you can have.
Good energy, food that fight underlying causes of health problems such as inflammation. No one ever discusses this topic. Please go over healing foods, foods that help prevent weight and muscle loss, and the effects of uh, chemo and other side effects.
Um, that can be a whole presentation.
Okay.
um, you know, um, but no, healing foods. It's a lot of the anti-inflammatory foods. It's your fruits, your vegetables, your plant proteins, your whole grains, which is all the things we talked about. Just making sure you're including them in your diet. But again, you don't have to be just vegan to eat healthy, but it's a combination of things. So you can still include some animal protein, but you should also be including, plant foods, which are very healing.
Okay, this is going to be our last question. Someone would like to know if vitamin D and calcium supplements, if they're good to take on a regular basis.
If you're deficient in vitamin D, you should be taking vitamin D. It's a blood test, a simple blood test that your doctor can order. Calcium, it depends on your diet and it depends on your age as well. As we get older, we need more. So it's not a bad thing, but I don't know if it's right for you specifically. So feel free to take advantage of the dietitians that are at your cancer center. We're here to help you. We can look at your medical chart and see your individual needs, um, and see if you need the vitamin D and calcium.
On behalf of BMT InfoNet and our partners, I'd like to thank Ms. Silverman for a very helpful presentation and thank you, the audience, for your excellent questions. Please contact BMT InfoNet if we can help you in any way.